February marks Global Congenital Heart Disease Awareness Month, and with up to 600 babies born with congenital heart disease in Ireland each year, it's a condition that affects thousands of families across the country. Heart Children has developed a new individual healthcare manual to help schools better support children living with CHD. Joining me now are Emma Moloney from Tulla, whose 3-year-old son Cormac was born with a complex heart condition, and the CEO of Heart Children, Sheila Campbell. And you're both very welcome to Morning Focus. Emma, would you mind taking us back to your 20-week scan and what was going through your mind when you were told that something wasn't quite right? And before Cormac's diagnosis, how much did you know about CHD?
Good morning, Alan. So yes, back in October 2022, I was 20 weeks pregnant with Cormac at the time and attended my anomaly scan in Galway in University College Hospital in the maternity unit. And I suppose I had very limited knowledge of congenital heart disease. I knew a very small amount. I'm a home economics teacher, and we teach children about the heart and the importance of heart health and the impact of diet on it. And that was the limit, I suppose, of my understanding of it, and would have known maybe stories of maybe neighbours or people from our locality that might have maybe had a hole in the heart, for example, when they were born. But my overall knowledge of it was quite limited. So went for the anomaly scan, and I suppose in the scan I knew that there was an issue. The scan was taking maybe longer than it had with when I had gone for our daughter is 5, when I had gone for the anomaly scan with her. And the lovely sonographer at the time, she had said that, listen, there's something here that I feel it's the one side of the heart, the left side, is a little bit small. I'd like to get a second opinion from the prof that was on the day. So the prof came in and he had said that, he trusted the opinion of the sonographer and that he agreed that I would be referred to the Coombe Hospital to Dr. Caoimhe Lynch in Dublin. So following week, I presented to that appointment with Dr. Lynch and with Dr. Orla Franklin, and they confirmed that the left side of Cormac's heart was very underdeveloped and very small. And they were able to give a diagnosis of hypoplastic left heart syndrome.
And presumably you'd never heard that term before?
No, I had never heard of that. I knew hypoplastic, I knew, left heart, I knew syndrome, but what that fully meant and how that would impact Cormac and the treatment that he would need, I had no idea at that time.
And the treatment began pretty quickly, under Cormac undergoing open heart surgery at just 3 days old. I mean, how did you cope emotionally, knowing? Well,
I suppose we were so well supported. Immediately after the 20-week scan, once it was confirmed in Dublin, we were linked up with a clinical nurse specialist in Crumlin Hospital in Dublin, and they were outstanding at supporting us, informing us, educating us, just making sure that we understood every step of the process, supporting us through that process. And with Heart Ireland, we were linked up with a psychologist that we were able to have, a session with and kind of work through our emotions with them. And that was so helpful. And the other big support was our family. They were absolutely incredible to support us, every step of the journey with Cormac.
Cormac has already undergone multiple procedures. How, as a family, have you found the strength to navigate that journey?
Well, I suppose we have an amazing network of family, of friends that have supported us, and I suppose at work as well. Everyone has been absolutely brilliant just to hold us up, keep us, together, and to be with us every step of the journey. The support from Dublin has been amazing. And when I say that, I mean from Crumlin Children's Hospital, from our CNS, from all of the consultants, the nurses, every staff member that's there have been absolutely wonderful. And Heart Children Ireland as well are such an important resource for parents and for families as well, just to mind you and support you through really, really difficult days.
And you said you feel lucky that there have been no major scares. I mean, does that change how you view everyday moments with Cormac and as a family, Emma?
Oh, absolutely. I mean, every single day is a blessing. It's a gift. And we're so fortunate to have him. He's been through, he has a very, very serious heart condition. He's been through incredibly high-risk surgeries and he's come out the other side. So we feel very, very, very blessed and very lucky that he is, a bubbly, happy, energetic child for the condition that he has, when he's really operating with just one side of his heart. We do feel very, very lucky.
I'm wondering how Cormac deals with all of this, Emma, but I suppose when you've been when you've had procedures since you were literally days old, does it just seem like the norm to him? Does he handle hospital visits and procedures pretty well all through, or as he's grown older, has he become more accepting of it?
As he's grown older, I suppose he has found it more challenging. So, as you said, he had his first surgery when he was only 3 days old. He had his second open heart surgery when he was 6 months old, and he's had 2 stents put in before he turned, the age of 2. So now that he's 3, he celebrated his 3rd birthday on Saturday, just gone. He's at his last hospital appointment now. He is that little bit more nervous, I suppose, and anxious when he sees, the hospital gown comes in and he has to go down to maybe go under general anaesthetic to get a scan done. He does feel more anxious and nervous about that, and that's, I suppose, where Heart Children Ireland are so important, that they have play therapists and play specialists, because for children that are that young, that aren't able to fully communicate their feelings, it is so important to have those supports there to help them through that trauma, because it is traumatic for a very small child.
Yeah, and Sheila Campbell, the CEO of Heart Children, talk to us a little bit about your organisation, and Emma's touched on how important you are for families with a child who has CHD. How do you help them? I think we have lost Sheila on the line. Have we? Sheila, are you there? No, we'll see if we can get Sheila back. But just to go back to yourself, Emma, how's Cormac dealing with creche? And what were your biggest worries about him starting?
So creche has been fantastic for Cormac. We are so lucky that he goes to a wonderful, wonderful creche in First Friends in Gort in County Galway, in South Galway. And they are just fantastic to bring on his social skills. All of the different learning through play. It's been so important for him, and it's really helped him develop. I suppose you would feel very nervous when he's starting that, will he cope when you're in that natural and creche environment, when you're picking up little colds and flus and viruses and just the normal things that happen when you're mixing with children so much of the day. So we were obviously we were a little bit nervous about that, but we were so lucky that our daughter attended the same creche, and we know what a fantastic place that it is, and he loves it. He enjoys it so much. He is so happy going in every single day, and they're fabulous there. And the resource that Heart Children Ireland have produced, the school manual, it's so useful for creches as well, because that's the first stepping stone of a child going into that school environment, from creche into their ECC preschool, and from then on to primary school. And it does lay out it's a whole holistic approach to every piece of information that a creche or a school setting could need about a child that has such a complex heart condition.
Yeah, and it is good that the childcare providers and schools are much better understanding CHD properly. Sheila Campbell with us, and Sheila was just asking earlier about Heart Children and what they do, and I suppose how they help families. Emma has already highlighted how important a role you have played in Cormac's and her family's life.
Yeah, so Heart Children is really there to support the more holistic side of caring for the child with CHD. There's fabulous medical attention received in CHI Crumlin, but it's when the child is discharged and sent home and back into the community, life starts to settle down for everybody, and then often, the trauma and the experience down the line begins to become evident. So children who've gone through repeated surgeries and interventions at the hands of medics, they experience a lot of trauma. It might take a couple of weeks for that to kind of become evident, or a couple of months even. And what we offer to parents is free play therapy close to home. So all parents need to do is contact us, and we will arrange for the child to see a play therapist. And indeed, it can be also the siblings of the child, because Heart Children supports the whole family unit, and sometimes the children who don't have CHD in the family also experience sort of separation anxiety when mum and dad are gone up at hospital with the sick child with CHD. And there's that sense of loss and kind of like, where has everybody gone, and abandonment. And that also can be a psychological problem for children who don't have CHD. So really what we're trying to do is manage the well-being of the whole family unit, the child with CHD, and make sure everybody is supported through the journey with congenital heart disease.
This month is Global Congenital Heart Disease Awareness Month. How important has that been, Sheila, in raising awareness and making people more cognizant and aware of those with CHD and what the particular do's and don'ts around that are?
Well, I think it's a big job worldwide to advise people of what CHD is. I mean, we all know what a heart problem is, but many parents will tell you that when they tell somebody that their child has come out of hospital after having an operation, the assumption is that the child is better, that they have been fixed and everything will get better. But for many families who have a child with complex CHD, it really is a repair or a plaster on the job until the next time. And so there is that sense of people not really understanding the extent and the impact that it has on everybody. What we want to try and do is bring that back home and explain to people that CHD, every year there's up to 600 babies born with CHD in Ireland. That's 3 times almost the number of children who receive cancer diagnoses. And so, we all know about cancer and we all know how it impacts on children. It's very visible. With children with CHD, it's an invisible disability. A child today could look very well and tomorrow they could be back in hospital having open heart surgery. So it's very hard to convey what it is sometimes and to convey that it's something that the child has from before birth. So as the baby is developing in the womb, the heart is not forming correctly. And so at birth then there are the problems, the muscle being a pump in pumping blood correctly through the body, which obviously can have devastating consequences when it's not working properly. So I think it's very important that we try and show a level pegging with something like cancer, a childhood diagnosis of cancer, because, it has such an impact on everybody. And for the young person with CHD, it's very important that I suppose they have the recognition and people understand a little bit maybe of what they have and what they're going through as they go through school, as they go through their normal social activities in life.
And you are hosting the Beat Goes On conference for people with CHD and their families. That's happening at the Chartered Accountants House on Pearse Street in Dublin on Saturday week, the 21st of February at 9:30 in the morning. My thanks to you, Sheila Campbell, CEO of Heart Children, and also thanks to Emma Moloney for being with us